So, good afternoon, everyone. My name is Arne Burns, and I am the Health Education and Training Specialist here at IPHA. And welcome to our Fed Talk series. And today with us, we have Godson Kofi Davies and Kene Chukwu Monike. And they are both MPH students at U of I Springfield, and they're going to talk to us today about artificial intelligence, readiness for public health, transforming Illinois' local health departments. So I'm going to go ahead and turn it over to both of them for our presentation.
Thank you very much, Annie. And we are equally very excited to have this presentation. And we've actually been looking forward to it. We've had a series of discussions on this. And we believe at the end of the day, we will know how artificial intelligence has come so far and where it is taking us to for a better future. So, in today's presentation, we're going to be looking at some fast facts about artificial intelligence. We're also looking about some of the risks associated with it. I'm also going to share my personal experience of how I have used AI for several activities so far and how it has been beneficial to me. We would also look at discussing how AI has been, how AI helped during COVID-19, how AI is impacting on healthcare delivery, how AI is also helping fight healthcare fraud, waste, and abuse. And then also the kind of AIs that we have in the system that we use on a daily basis that we don't even know about. We're also going to look at discussing those aspects of it. And then also we are going to look into the spectrum of services that our local health departments focus on, and then see how AI can, help solve or help enhance some of these deliveries. Yeah, so we are a team of project mates. Like Annie said, my name is Godson. I'm from Ghana. I started GD Consult, which is basically a public health consulting firm located in the central region of Ghana, which is one of the poorest regions in Ghana. And so we come up with various health interventions to help rural communities, enhance their health and well-being. Kanechukwu is a Nigerian. He is a pharmacist by profession. He's been practicing for some substantial number of years. He also is a data analyst. And then we have Latifat. She also has an NGO and is a medical researcher. She is a liaison officer as far as this project is concerned. And we have Oluwaseun Adeleke, who is a medical doctor. And so you can see that our background is very diverse. And so it spans from technology to, getting to the clinical aspect and then looking at the research aspect as well. And so this is a team of four people who came together. I was 4 students of University of Illinois Springfield, who came together to make this project happen. So let's go straight to some of the fast facts about artificial intelligence. About 77% of devices we use now have artificial intelligence. It's even on our phone, it's on our computers. You can find them on Facebook, you can find them on TikTok, WhatsApp, they are there. Everything about the devices we are using now has a component of artificial intelligence embedded in it. And about 9 out of 10 organizations, are taking advantage of AI as of now. And AI is also projected to contribute about 15.7 trillion by 2030. And we're also saying that by 2025, AI might eliminate about 85 million jobs and create 97 million jobs. It means that there's going to be an additional gain of 12 million jobs at the end of 2025, which is just next year. And 63% of organizations also intend to adopt AI globally within the next couple of years. And we are looking at AI growing by 120% year on year. After, companies have adopted it and start running with it, it will keep growing by the day. And so It's not something that we're going to go back, but it's rather going to, improve by the day and then enhance operational activities as far as various aspects of work is concerned. In 2024, AI market is projected to grow about 30%, which is very true. This year, I just had an AI application that helped me to develop my personal website. And so in the course of the presentation, I'm going to be sharing that with you. And 88% of users are unclear about generative AI. I believe those of us who are students are a bit familiar with generative AI, which helps or assists in creating content for most of our projects that we do now. So, yeah. Another fast fact is about from 60 years plus, people are actively using devices that reduces the kind of movement or the stress they would have to go out. Setting their time playing music on their computers or on their televisions and all of that. Now, in the comfort of your room and on your bed, you can instruct Alexa to tell you the time, and they will definitely tell you what time it is. They can even tell you tomorrow's weather. They can even tell you the latest news updates. Siri can just dial somebody's number on your phone without you having to touch the phone. If you wanted to put your phone on speaker, it does put your phone on speaker. And so you don't even need to touch your phone now to make a call. You can just instruct it wherever you are sitting. So far as the proximity is okay, it's going to pick your voice and then do whatever you instructed for you. So that is a form of artificial intelligence. We don't even know. Most of us don't even know it's a form of artificial intelligence, for want of a better word. And 14% of 41 to 60-year-olds are using virtual assistants. Now you go on the net, you're looking for stuff, you're looking for items, you would have somebody or you have a robot who is ready to interact with you and give you exactly the kind of answers or responses that you need. And so people are now also directed towards, that kind of aspect of service. Because some time ago, if you call a call center or you try to contact a company, you're going to spend more than like 30 minutes to an hour to be able to speak to a representative or an agent. But with robots embedded on websites now, we are able to interact and get a kind of feedback that we want. And so there are various aspects of virtual assistance that we are adapting daily in order for us to be able to enhance our services. Now, another fast fact we have to also know is about 22% of firms are aggressively pursuing artificial intelligence integration into their services. About 33% of firms are also engaging, or are also engaging in implementation actually. So they've gone past doing a needs assessment. They've gone past maybe looking at their infrastructure and all of that, and they are in the process of, implementing AI in their daily operational activities and routines. And about 45% of firms are still, at the exploration phase. In the field in which we find ourselves, which is public health, I believe a lot of us or a lot of institutions are still trying to find their bearing as to how to go with artificial intelligence. In as much as we see a lot of good aspect of artificial intelligence, there are also some risks that are associated with it. One, of course, most of us are afraid of, losing our jobs. And to tell us for a fact, a lot of jobs are also going to be lost. But then if you're able to enhance ourselves as far as this kind of technology is concerned, there's no need, losing your job. Even if you lose it, you're going to get another opportunity that relates to that field because you have acquired that skills. We also have the issue of deep fakes, which means that you can have a picture of your kind, a representation of your kind, just as you look. But then when you go into detail, it probably may not represent you as the real person behind that particular image. And so fake There are a lot of fake items coming. There are a lot of fake accounts, software accounts coming that are done, replicated just the way the originals look like. Now people can create, or they can clone your bank account just for it to look like it's your bankers that have sent you probably your bank statement and all of that. So it's another form of risk that is associated with it. And then we also have the issue of privacy violations. We have algorithm bias, which is more or less depending on who is issuing the prompt. They probably may issue the prompt to suit them, or to probably based on the kind of data they want. And so it doesn't look at a generic kind of data, but then create algorithms that will suit probably a specific situation that doesn't cut across. And so that's also another issue. And then when we look at socioeconomic context, definitely people who don't have access to reliable internet will also have the challenge of accessing or having a very good usage of AI, and so this is another issue. And then market volatility is also another one. And then weapon automation is another aspect of it that, all forms part or basis of the risks that are associated with artificial intelligence. Now, gone are the days if I want to create a pictorial imagery of my daily routine, I would have to engage the services of a graphic designer who would have to come up with a concept, share the concept with me, have series of meetings to agree as to how I want my design to be done, and then they will come up with a draft sketch, and then you'd have to look at it, send it back to them to also preview, and then whatever. At a point in time when you need specific timelines or when you need your deliveries to be made, they can tell you, I'm attending a funeral this weekend, and so I'm unable to meet the timeline you've given me. Or my daughter is sick and I'm unable to work. And so it extends your duration, or it inconveniences you time-wise. I prompted an AI application to give me my daily routine in pictures. I just want to have my daily routine in pictures. I am Black. I am masculine. I work from home. I cook myself because I live alone. I go for classes, and then I'm a gym freak, so I go to the gym. So I instructed, or I prompted AI that these are my specifications. This is how I look like. And so generate how I look like per the description I've given you. And then, put them in a pictorial version for me. So based on the prompt I issued to the kind of AI application, it generated this very nice pictorial version for me. And so I was time specific. I wake up at 6 a.m. So it wrote 6 a.m. on the picture. I take my shower. I start work at 7:30 a.m. So 7:30 a.m. because I'm working from home. I'm not wearing any shirts. It's okay. I live alone. It's comfortable. It puts a computer right in front of me, sets me up like I'm working. And then I have my lunch at 12. And so 12, it's created an image of me, having my lunch and all of that. At 6, I'm a student. I go for lectures. So it puts me in a lecture room. At 10, 10 p.m., I go to the gym. And so it also generates a picture of me with my masculine body at the gym. So this was generated by AI in split seconds. It wasn't even up to a minute. Within split seconds, it generated all these 5 images for me. But then, as you can see, there is a little bit of an inconsistency in the imagery. I don't know if anybody can detect that and let me know in just about a second. Can anybody, you can just unmute and tell me what you see as an inconsistency within the imagery. Anyone? Okay.
Someone in the chat stated hair.
Exactly. So that is it. In as much as we rely so much on AI, it also gives us, at times gives us some kind of representation that doesn't give you the actual stuff that you want, or the actual thing that you want. And so I'm Black. I have my hair is cut and all of that. Now, at a point, it gave me an Afro hairstyle, which doesn't reflect all the rest of the images that is created. So in as much as we want to adapt AI, there are certain details that we have to look out for as far as the story is concerned, or as far as any kind of AI application we may try implementing or adapting in future is concerned. There are going to be some inconsistencies that we have to look out for. And we'll keep improving on them as time goes on for us to be able to get a better system. This is my personal or my company website that I created myself with the help of AI. And I've placed the link to the website because of the time of presentation. I'm not able to go there, but you can take the link and then visit the website, my personal website or the company website. Everything you see there is AI generated. So you can see an image of a woman who is smiling. It looks very real. It looks like I took the picture with my camera, but this image is AI generated based on the prompt that I issued. The picture of a doctor playing with a kid was generated by AI. It's real. You may not believe it, but it's AI that generates. If you zoom into the screen of your computer, you can even see that it's written over the AI generated. The kid who is smiling or playing was AI generated. Every design of the website that I created was AI generated. So AI helped me generate or revamp my website without having to buy any images from anybody or to seek the services of any professional website designer. And so at the end of the day, I was able to save maybe $1,000 for someone to design my website for me or on my behalf, And then also, it took me about 3 days to 4 days to be able to come up with this website. If I had given this to someone to design, probably it was going to take a month or a couple of days more to be able to, finish. And so good turnaround time. You are able also to generate new skills if you are very savvy and you want to be learning more. This is something that you can keep exploring, and you keep sharing ideas, keep talking to people who are AI oriented, and they will give you, guidelines as to how you can do some of these things. Now, let's look at AI during COVID-19. It helped us with regards to epidemiological tracking and prediction. And so we're able to know how the disease was fast spreading, we also, that was the dawn of remote working as well. A lot of us had to go home and be working from home. And so most of us started adapting to working from home. Technology companies also took advantage of the fact that they can create apps or softwares that can enable us work productively from home and then engage as much as possible. As far as work is concerned. It also enhanced or it's increased the speed of, diagnosis. It also accelerated COVID-19 vaccine development. Gone are the days where you probably would have we would have waited for like 5, 6, 7 years for us to be able to get vaccine to tackle COVID-19. But then with AI, we're able to accelerate the development of COVID-19 vaccine. And so that is probably one of the reasons why most of us probably may be alive today, And then also healthcare automation, where they had to use robots to do disinfection. We use robot to do supply deliveries and all of that. This helped a lot and this is as a result of artificial intelligence. Somebody came up with a concept, designed it for us to be able to have our places disinfected in order to reduce or minimize the spread of the virus. Supply chain it also helped us determine where we had a lot of cases and then enhance how we're able to, allocate resources to the kind of areas that really needed those help. In healthcare, AI helps in drug discovery. It's helped a lot, and it's even enhanced, it accelerates it actually, and then provide recommendations and all of that. It also provides predictive analytics as well, and personalized patient treatment. We have applications that are able to store patients' history and then personalize the kind of treatment plans that they have for them. There's also the issue of operational efficiency, where there are certain routines that AI can easily take care of. You don't need to have someone sit behind a computer to do. And so rather, a human being do that. An application will take care of it so that a human being can probably concentrate on, the real things that matter. It also look at integrating ethics into and compliance into some of the activities that we take care of. And we also have numerous health chatbots and virtual assistants as of now. Today, you don't need to drive 15 minutes or 1 hour or 3 hours to get to the hospital. You can just sit at the comfort of your home and engage a health professional via chat box, and they will engage you to the extent that they can even issue prescriptions via this medium to you. Telemedicine has become part of us now. We are able to speak to our doctors on phone. They're able to engage us, and we're able to get the kind of assistance that we need as far as our health is concerned. Radiology diagnostics, AI is making headways in that aspect of our lives as well. I happen to be doing my internship with OIG, that is Office of Inspector General, where we investigate fraud, waste, and abuse, Medicaid wise. And so we've been able to generate, or we've been able to use AI to detect fraud anomalies, billings. We also are able to see, predict trends, and then see fraudulent activities that happens on the part of the provider, on the part of the physicians, suppliers, and all of that. AI is able to detect fraud in the system, and these have been integrated into their system. So if an auditor would have to use probably 5 days to work in an audit, with the help of AI, they are now spending less time in detecting fraud, because AI will do probably half of the work for them. And so what they would have to do is probably the physical engagements that they would have to be doing with the providers and all the other stakeholders involved. And so AI is also helping in fraud, waste, and abuse. So when I started my presentation, I said that we use AI on a daily basis, and we don't even know. Some of them we don't know. There are search engines, looking at the pattern of your searches. Now, so I'm traveling to Ghana, I needed an air ticket. And so I went on Google, looked out for air tickets. I looked out for a number of them. When I turned on my TV and I was watching something on TV, I also saw that adverts that sync with the kind of search I looked out for in Google now are appearing on my television. It happens all the time to us. So sometimes I wonder, I just searched this on the internet, why is it appearing on my TV? It's because artificial intelligence has been able to look at your search pattern and integrated it to your television. Sometimes if you are listening to even online radio, those kind of adverts will come, because depending on your search pattern, it will give you the kind of commercials or the kind of information that you want as and when, email filters will come based on your search pattern. And so I received an email from an airline giving me an offer for my ticket. Sometimes you receive text messages and all of that. There are a lot of privacy violations. And so most of these things, you don't even subscribe to them, but automatically they appear on your phone. These are some of the risks that we would have to look at. But, it broadens the kind of your scope of search. So probably what you looked out for Google was not too appealing. Probably what you see on the television would give you a better, offer that you wanted. And so retail companies are using it. Banking apps are using it. If you search for a credit card right now, you will have a lot of credit card companies flooding your email and your computer, because that is your search pattern. And so AI is able to align your search or your preference to what you want, and then give you the kind of options that is available to you. And so this is the work of AI that we experience on a daily basis. Now, having given a general overview of how we've adopted or how AI is going now, how will it affect the kind of industry we are in a positive way? How can we adapt AI to achieve greater things as far as public health is concerned? And which aspect of our operations do we think we're able to, adapt AI to enhance? Looking at the spectrum of services, which I believe most of us here may be familiar with based on our roles and responsibilities. We came up with some of the areas that we can start looking at now. One is our administrative or the administrative aspect of our work, where AI can streamline and automate certain administrative tasks like scheduling, records management, data entry, and all of that. And so once this is done, staff can also, if we are able to adapt, very good AI applications to be taking care of some of these things, the staff can focus more on field work and engaging with the community to also determine what their real needs are. Education-wise, AI can generate a lot of content, for personalized education. It can also predict behavior patterns. We can also adapt, develop content, and then introduce a chat box that will be educating staff and the general public on prevailing health crisis or prevailing health activities that are going on. Also, you are able to enhance more, reach more. And then also, when it comes to demographic-wise, you can segment communication to suit specific age groups or specific kind of ailment groups and all of that. These are things you can easily do with the help of artificial intelligence. You can gather data with AI. I was conducting a research and I needed the data. I had to just instruct ChatGPT to generate a certain form of data for me, and then give me the source of that. It gave me the data that I wanted. It told me the website that I can get that kind of information. I went on the website and I could confirm that, yes. And it can just bring from different sources and give you all the references to those sources. So you have various perspectives to the kind of subject you probably are discussing. And so for education, we can use generative AI to help create content and then train staff, educate the public, and what have you. When it comes to chronic disease prevention, there are AI applications that can be integrated into our systems that will help with predictive analytics and then also personalized health interventions. There's also, we have clinical providers and nurses. There are AI applications that can help with diagnostic support at the local level, and then also look at patient monitoring. These are things that we can easily integrate into our AI infrastructure, our public health infrastructure, to enable us be able to support the people who need it most. In IT, AI applications or algorithms can help enhance data management. We also have the issue of advanced analytics, where AI can extract meaningful data from large databases and also help in decision making and policy development as well. For human resource, it can also help with recruitment and training. Training contents can be developed. AI applications can help you select the best of talent or match talents with the roles that are available as well. These are applications that can easily be developed and integrated into our health system to enhance productivity. We can also look at the issue of community health workers. It can enhance their engagement and then also provide educational tools for them. We don't need to go to them at their various locations. We can just create this content to suit their specific locations wherever they are sent to them, and they can be able to, learn on the job. We also have an aspect of disaster planning where, AI can also help as far as our work is concerned. Crisis stimulation and then response. AI can really support in this aspect of our work. Now, one thing that we are very much scared of, or we've been very much afraid of, is with this fast pace at which AI is growing, is it going to replace my work? Is it going to take over my work? Am I going to be unemployed in the next couple of weeks? What is going to be my fate as far as this, AI is concerned, especially when it's integrated into public health programming? AI, we believe, is rather going to enhance our capabilities, and allow workers to work on more and make more informed decisions and make very strategic planning. And so instead of us thinking that it's going to replace our work, it's rather coming to enhance our work and then increase or improve efficiency or productivity. And so things that you could use like 3 hours to do, these things can now be done within 15 or 20 minutes. It helps you brainstorm more and then come up with more practical approaches as to how to address, health disparities that, we come across with on a daily basis. It also will help us in making decisions, and then also address skill gaps, which means that AI will be providing us with up-to-date content, educating us with up-to-date content. And so there probably may be stuff that the state of Texas has implemented, local health department has implemented that, Illinois is not aware of. By AI integration, it's able to tell you what all the other states are also doing as far as this, public health is concerned, or our activities are concerned. So we're able to also take snippets of all of them and develop ours and make it work for us, solve problems with it, and then, better lives with it. It also will help with personalizing health interventions as well. And so if there's a specific county that has a specific kind of illness patterns, AI will be able to predict and help you address. So it's rather would predict and then propose measures you can adapt in order for you to effectively solve those problems within a very minimal timeline. And so it's effective, it's efficient, it reduces the stress and burden on the worker, and then also enhance the work you are doing in good time. So these are the things that we rather should focus on. And if we are lacking in that aspect of, as far as education is concerned, we can always take up AI courses. And the good thing about it is once AI is implemented, every staff is taken through the process. They are taken through, if there has to be training, they will train you how you are going to, use it to your advantage as far as the operations of your work is concerned. So as much as possible, let's try and enhance or adapt AI, see AI as a good thing rather than seeing it as a replacement to our work. Thank you very much. This is the end of my session. The next session is going to be taken over by Kenechukwu, who is going to tell us how we can adapt AI, Illinois Public Health Department. Thank you.
Thank you, Godson, for bringing us this far in the presentation and for educating us about AI. Without wasting much of our time, I'll just go straight to the point, and I'm going to be talking about the AI Readiness Needs Assessment survey in our local health departments in Illinois. And the aim of this is to conduct a needs assessment in the Illinois local health department to see how we can, chart the existing gaps and, see potentials or potential areas for growth, and lay a solid foundation for strategic planning, capacity building, and seamless integration of the AI applications in our local health departments. A few objectives we have to understand the current state of AI integration within our local health departments. We want to know, how far AI has come in our local health departments and how far, we can go with that. We also want to evaluate the current AI literacy among, our current health departments as well and identify the gaps in the knowledge and skills. We'll gauge the willingness of the leadership of our local health departments to, adopt AI and integrate AI as well. We also want to understand the specific public health challenges and the needs of the local health department in Illinois and see areas where we can actually integrate this AI. And to conduct this needs assessment, I would like to say that, it's considering what my colleague Godson has said, you know, it is AI. AI being an integral part of our daily activities, cannot be overemphasized. And this has given us a reason to come up with a proposal to see how we can conduct a needs assessment in Illinois and, see how we can integrate AI to benefit us as a state. And we've come up with various methods to see how we can integrate this and carry out this needs assessment for us to be able to move forward with AI. And with that, I'll say that the AI readiness needs assessment survey will be conducted using a structured and comprehensive methodology, and this will ensure that it captures all the details and relevant information about the current state of the AI integration in Illinois. And we plan to do this using cross-sectional survey designs, and the survey will be meticulously designed to assess, various aspects of our AI readiness. And this will include, technology infrastructure, staff competence. It's also going to include the current AI usage and attitudes of our staff, towards artificial intelligence. These questions are going to be both quantitative and qualitative questions, just to be able to gather a comprehensive data. Also, we're going to do our stakeholder engagement. Prior to deploying this survey, we want to identify our key stakeholders from various health departments, community organizations, and other relevant entities, within the Illinois local health departments. And this will ensure that the survey will address all the needs and concerns of all the parties involved. We have a target audience actually, and we propose that the survey will target a diverse group of respondents across the different divisions in the local health department. And this will include the administration, it's going to include the clinical providers and the nursing staff. It's also going to include the teams that deal with the chronic disease prevention. It's going to include the human resource department. It's going to include the community health workers, disaster planning coordinators, and compliance and regulation affairs staff. And by the time we are done with all these, we intend to collect data digitally, and this will help us to to have a broad reach and make the survey very convenient for all our participants. A secure online platform will be used to administer this survey, and because of the risk of data privacy and confidentiality, we're going to ensure that we take care of that aspect by implementing um, um, measures to control the data privacy and confidentiality. As part of our targets, we intend to conduct this. We intend to conduct this survey and target 2 staff members from each division of the 97 local health departments, along with additional representatives of the Illinois Department of Public Health, that's the IDPH, and the Illinois Public Health Association. We also want to make sure that at least we have 20 community members represented during this survey. And after that, we are going to produce deliverables utilizing the insights that we've gained from the stakeholder engagement and the needs assessments that we've conducted. And we intend to use this to customize roadmaps for AI adoption for the local health departments, These roadmaps will definitely consider, the health department's specific needs, which is very important. We want to make sure that we are tailoring the AI aspects, the AI integration to what we actually need, and not just AI for AI's sake. The current readiness levels, the resource availabilities, and strategic goals of Illinois. And it's going to outline a step-by-step approach that we're going to use to implement this AI for both the short-term and the long-term initiatives. The roadmap is also going to include a timeline of which this research is going to be carried out. It's also going to show us the milestones for success and the key performance indicators to track our progress while we are on the project. Also, after this, we're going to give a feedback, and the results and the recommendations will be shared with the stakeholders involved. And definitely the feedback will be sought to refine and improve all the AI readiness strategies that we need. During the assessment, it's important that I mention, that this AI readiness assessment is not a one-time assessment, but it's an ongoing process. And the surveys may be conducted, periodically to track our progress and address emerging challenges that may occur. And as we go on, we'll update the adoption strategies that we need. For the timeline, we intend to conduct these needs assessments within 11 months from the inception to the completion. And within the first 3 months, that's when we intend to, do the survey and engage our stakeholders to understand, their point of views, the current state of AI implementation in the States, and also to know where their mind is at the moment. And after that, by the time by the end of the 3rd month and starting from the 4th month, we'll definitely want to, do our first analysis, our initial analysis of all the data that we've gathered. And by the 9th month, we'll do a final analysis, produce a report to show us all our findings and recent development that we've gotten from the research. At this juncture, before I end, I would like to say that, together we can harness the power of artificial intelligence to transform our public health landscape in Illinois. As we move forward with integrating AI into our local health departments, it's important for me to say that, and for you to know that your expertise and your collaboration is very crucial. I implore you to join us in this AI readiness initiative, and whether you're part of the health care departments, the community organizations, whether you're in an academic institution, your insights and participation can drive a meaningful change. So let's work together to harness this power of AI to help us in our healthcare in Illinois. Thank you so much.
Hey, thank you both so much for the presentation. I wanted to now open the floor if anybody had any questions. I didn't see, there was one question in the chat if the presentation slides will be available for sharing. Is that something that would be possible?
Yes, it will be available to share.
Okay, perfect. So I'll connect with you all and then I'll have you send me that information. I can send that out to everyone here that's registered. Does anyone else have any other questions? If you'd like, you can unmute yourselves or you can throw them in the chat and I'll go ahead and read them. Any questions? Will be the last call for questions. Hey, if there are no additional questions, again, I want to say thank you so much to Godson and Kenichukwu for your presentation for today. I definitely learned a lot, and I hope everybody who participated learned a little bit more as well. I hope you all have a wonderful early weekend. I know it's Thursday, but I hope your weekend as well. And we hope to see you at our next Fed Talk presentation. So thank you all so much, and until next time, bye.